And here we are on Soul Food. It's 2 minutes past 8 o'clock. You're listening to Smooth 98.1. We love music. We love life. We love you. We love your health and wellness. And that's why we have the segment every Saturday morning from 8 till 8:30, talking about your health and wellness. And this morning, we have brought you a consultant ophthalmologist with many, many years of experience to take time out of a very busy schedule just to come talk about aging and eyesight. So that means you have to increase the volume of your radio set and do not miss out on any information. It also means you have to share this stream with your family and friends. And by this stream, I mean the YouTube stream. So what you can do is go to our YouTube channel. It is youtube.com/smooth981FM Lagos. There you'll see my face and that of my guest, and you can share it, save it, and of course, go back to it when you want. You can also stream live via the audio via the website, www.smooth981.fm. That's the website. That's it. I am talking about Dr. Dupe Olorunnimbe, and she's joining me via Zoom. Good morning.
Good morning, Seun.
Thank you so much for your time this morning. I appreciate
Thanks for inviting me.
Okay, so getting right into the mix of things. A number of things come with aging, growing older, right? Psychologically, biologically. So let's get started with those things before we go to maybe the abnormalities on those conditions that are not normal. Let's start with the normal thing. What aging and eyesight, what aging does to your eyesight normally? Yeah. Or is there no normal thing?
There is. I was just going to make the distinction. As people age, most of us will encounter changes in our vision simply because we're aging. And that is different from having an eye disease. It's the aging process, the wear and tear on the eye. And these processes are quite different from eye diseases that may occur in old age. They're just the processes. For example, when we're getting old, we get the wrinkles, we get more folds on our faces, and the eyelid, and the eyelids tend to droop. So they don't oppose quite normally as we should. That's just an example. Therefore, in the elderly, some people may say, oh, I have tears coming out all the time. And that's because the eyelids are not opposed to the eyeball to drain. That's just one example, to drain off the tears. So many times we can reduce the effect of age on our eyes, and that depends on what we do when we're in our 30s. So we really should, this lecture should also be not only for the elderly, but for those who aim to grow old, so that they know how to reduce the processes of aging on the eye.
Thank you. All right, so there's something I want to understand. When people grow older, does it also reduce the ability to tell colors apart? Maybe you can tell black from navy blue or gray from ash, or does it also reduce that?
It does. Okay, the cells in the eye that are responsible for color separation, they're called the rods and the cones. I just have to say it that way, but just believe that there are some cells responsible for color appreciation, and saturation. So as we grow older, those cells drop out, and then they don't regenerate as rapidly as they do when we're young. So really, definitely, color appreciation reduces. Maybe not black and gray like that, but even red, even the bright colors. And that's why you find out that many elderly people would come into a room and turn on the lights when the lights are on already. And they'll say, they need brighter lights to appreciate differences in colors, even in the food that they eat. So the rods and cones drop off because we're getting older.
Okay, I particularly like that light aspect you mentioned. For some, they seem to increase in sensitivity to light. For some, they want more light.
Yes, that could be caused by opacities in the lens called cataract. Some of them would come into a brightly lit place, and the pupils will go smaller. In fact, one of the age-related changes in the eye is a smaller pupil. That means it reduces the amount of light going into the eye.
Okay.
Therefore, they will say they want more light. However, if they have opacities, it scatters light so much. The lens is supposed to be transparent, but if there are opacities scattered all over, then the light rays coming, they're scattered. They'll come in and say, please reduce the light. I mean, there's a glare somewhere that I'm not enjoying. So they want it reduced.
Okay, that's interesting. Now, is there an age range or age bracket when a person starts to notice these normal changes?
Some start as early as 40, but the most common cause of reduced vision in the elderly is cataract, and we are not surprised to see it from age 60. So we expect if somebody comes in and is 60 plus and has cataract, we are not surprised. Like I said again, every other thing depends on how you've used your body in the early days and what you've eaten, smoking, alcohol, all those will bring in changes earlier, but they'll bring in the old age-related changes earlier, all over the body, not just the eye.
All right, since the name it has popped up twice or three times in the course of this conversation, we can as well talk about it, cataract. I feel if I had $1 for every time I heard cataract and glaucoma with eye condition, I'll be so rich.
Yeah.
So let's talk about cataract as being one of those things that is definitely not normal, right? With age,
No.
or is it normal? All right, so let's talk about it.
Well, like I said, it's like gray hair. If you grow old long enough, you will have gray hair. So some people do have clouding lenses from even before age 60, like I said. But if the person is 60 and has cataract, we'll call it an age-related cataract. You can also get cataract from diabetes. You can get cataract from trauma. You can get cataract from alcohol, smoking, all those things, and then walking too far out in the outdoors. So how do you prevent cataracts? You can wear sunglasses because of the UV rays coming in from the sun to protect your lenses. But the truth of the matter is, either way, cataract reduces your vision unnecessarily, and it's something that is treatable. So by going to the right eye specialist, you can actually get that cataract removed. And then you get an 80-year-old seeing clearly, as clear as a baby, because she has had cataract surgery. So it's not a pleasant place to be if you have a cataract and you just leave it on there.
Okay, so still on cataract, I would want, for the sake of someone who has heard the name many times, but does not know how different it is from any other eye condition. So what are those symptoms of cataract?
Gradual loss of vision, pinless. Pinless gradual loss of vision is what they complain about. And because it is gradual, many people tend not to complain about it. For many reasons, they don't want to bother their children. I can still see, I can make my way around. But when you have cataracts, you also increase the probability of falling and injuring yourself. I want to encourage anyone, if you're just noticing a painless gradual loss of vision, see your eye specialist, because it's not also only cataract that can cause that painless gradual loss of vision. You have glaucoma. The difference between cataract and glaucoma is that cataract is treatable. You can go and have your eye surgery done, and then you can see clearly. So there's no reason for anyone to be blind from cataract. It's painless, so I can't say, if you have pain and you have cataract, then you have something else in addition to the cataract, and that has to be seen too. How else can we also delay cataract formation? You can delay dietarily, taking eye supplements that contain antioxidants like lutein, zeaxanthin, zinc, vitamin C, vitamin A. You can also do that nutritionally by eating dark leafy green vegetables, fish, oily fish that is rich in omega-3 oils. All of these kind of things strengthen the eye. People have cataracts, they don't know they have it in the early stages. But by the time you have significant loss of vision, that's the main complaint. You need to see the doctor. People are also scared of surgery. And then when they say you need surgery for this one, they'll say, no, is there no eye drop? Is there no tablet? But the truth of the matter is it's an obstruction. It's a covering of the lens that is blocking light from going into your eye. So you need to remove that and insert an artificial clear lens, and then you can see.
I mean, it can be understandable when people are hesitant about eye surgery, because if anything should go wrong, or village people step in the building.
I get that too. But mostly over the years, cataract surgery has evolved. In the past, it could go on for like 30 minutes. Now it could just go on for like 10 minutes.
Really?
Yeah.
Oh, okay.
Quite clearly, barring all village people visitations.
For someone who has been very scared about it, I hope that allays your fears that cataract surgery, the chances of success has increased over the years. Thank you so much. Now, there is one thing I commonly hear when it concerns aging and eyesight, and it is age-related macular degeneration. What's that?
Okay. First, the macula is the center of the eye that is the sharpest point of vision in the eye. And it's based on the retina at the back of the eye. You know, the eyeball is like an old camera. In the old days, we had cameras that had an aperture, a lens, and the film at the back. And the images are captured on the film. The retina in the eyeball is equivalent to the film, and the sharpest point of vision there is the macula. The age-related macular degeneration is actually the commonest cause of blindness in developed countries. And it comes with things that could, as we age, you know, the cells lose their ability to function so accurately and aptly. So sometimes it happens. And then it's common because some people have diabetes, some people have other things, hypertension, that will make age-related maculopathy come up faster and earlier and more profound in the elderly. It also depends on lifestyle in the past. We can keep our eyes healthy. And then at the early stages too, what you see is a loss of, you may see straight lines as wavy lines. So if anybody wavy lines, I think it's time to see your doctor. You may also see that there's a central point. You can see everything around an object, but the center is a bit difficult to see. And that way you really need to see the doctor. When that happens, all we have really are supplements, all those antioxidants and everything that will supply what the macula needs to stay healthy. But it's common abroad in developed countries, more common than here.
Is there a reason why?
Is there a reason why we have gray hair?
No, I'm saying in developed countries.
Over there. Over there. Okay, really? I'm sorry, I got that wrong. You know, over there, if they had a cataract, they would have removed it a long time ago. They don't stay on it like we do. Honestly, our age-related macular degeneration here in this part may be underdiagnosed because there's so many other things happening that we're running after. We have the glaucoma issue that is more severe in our race than abroad. We have the cataracts that we're still persuading people to go do. And by the time you remove the cataract, you may now have a clear view of the eye and see that there's also an age-related macular degeneration. So I think that they take early intervention for their eye conditions in the developed world than we do. So we're grappling with so many things going on at the same time.
That's sad. Let's take a call and see what this person has to say. Hello, good morning. All right, so if you have any questions, it's okay for you to call 014489981, or you can send your WhatsApp messages to 0809-444-0981. Again, 0809-444-0981. That is the WhatsApp line for you to ask any question or to make contributions to the conversation at hand. But again, if you want to call 014489981. Hello, good morning.
Hello, good morning.
Good
It's Michael.
All right, Michael, do you have a question?
Yes,
All right, please go ahead.
as I said earlier, I'm 52, and I discovered that I can't see more like I used to see. Just like what the person was saying. I'm a stylist. I discovered that these days now I need more light. Anyway, but everybody be complaining about the light, but yeah, I'm not saying how I'm supposed to say. But I know that I see blurry now. I don't see that. I can read anything from far. I can't read it with everything close to me, my blurry. So I see clearly looking far.
All right.
So
what's the question?
I don't know. Is the age 52 and what I complain now, is it normal or need or I have a problem?
All right, she will answer your question. Thank you.
Okay, thank you for the question. You know, I said that certain age-related changes also occur as early as the age of 40. We call that presbyopia, and that's when people start wearing glasses to help them with reading, popularly known as reading glasses. Their eyes are healthy, but for some reason, the muscles inside the eyeball cannot contract as rapidly. So when you're looking far, you can actually see clearly. And when you want to read something very close to you, you need light, or you have to hold it away from you. We call that presbyopia, and it's easily correctable by glasses. However, I've said that you can have a difficulty in seeing that is painless for cataract, and you can also have it in presbyopia. So how do you know the difference? That is why everybody is encouraged from the age of 40 to actually have an annual eye checkup. That's the best gift you can give to yourself, because if you go to a regulated place for your eye checks, they'll be able to tell you if it's just simple glasses that you need, or if you have to watch out for something in the future, or if you need medicine. Glaucoma, there's so many diseases in the eye that can lead to blindness, but are treatable if discovered in the early stage. So the truth of the matter is, from 40 on, I would advise, and like this young man, this man that has called, I would suggest that he sees an eye specialist, really, so that they can differentiate between whatever may be causing his blurred vision when it's near, and his need for bright light and everything.
Thank you so much. If you have any question or you would want to clarify something, again, we've got the WhatsApp line 0809-444-0981. 0809-444-0981, while the call line is 01-448-9981. If you're joining us for the first time, we're talking about aging and eyesight on Soul Food right here on Smooth 98.1. And remember that if you're dialing the number, turn down the volume of your radio set. Hello, good morning.
Hello, I'm listening to the program now. Please, before he will leave the platform, let him be able to help us with some of the reference points now where we can go for advice, either the federal medical centers or maybe hospitals that can handle problems now. Thank you very much. very much.
All right, what's your name, please?
My name is John Mba. I'm coming from Matekunekuchi.
All right, thank you.
Yes, ma'am. So this is the advice us before we go.
Okay, she's a she, but it's okay. All right, so he's saying that places, I'm sure you're not asking for specific names of hospitals, but at least general recommendation of where they can have their eye checkup.
Yeah, okay. Across Lagos, we have general hospitals, and at least 9 of them have eye clinics. What I find most people saying is that once they go to the hospital, they spend the whole day there. But that's just the magnitude of the work that we have to do as eye doctors. And we aim to see everybody well. Another myth is that, once you go and see an eye doctor, she's bound to see and get a diagnosis for you, and you start spending money. And that's it. Unfortunately, we also have a lot of itinerant eye doctors. I'll put them in quotes. They're not qualified, but they go and they reach the people faster. So the right place to go is actually a government hospital where everything there is regulated, or a private eye clinic or eye hospital, properly designated, and most of them would have the pharma sign on it to say that this is not a quack. Ideally, we must all have our checks once a year. Just take your birth month and tell yourself, this is my birthday to myself. I'm going for my eye check. Because unfortunately, if we live to be 90 and we are having eye problems from 60, so that means we have 30 years of gradually going blind when it is absolutely needless. So, sir, please go to the nearest general hospital or a private eye clinic that is properly designated by the government monitoring body, that this is a certified eye clinic. Take care of your eyes.
Yes, you have to. I think that was the theme of the World Eye Day, World Vision Day. Yeah.
Yes,
take
and
care of it.
Yes. And you don't get any ophthalmology gathering without people talking about actually improving. We just concluded a conference. The theme was improving access to quality eye care. It's an ongoing thing. We try to improve on it every day just to reduce the burden of blindness in our communities.
Thank you so much for what you're doing. So keep the calls coming to 014489981. It's now 25 minutes past 8 o'clock. So it means we have 5 more minutes if you have anything to get in, to ask or to clarify. But I'm particularly glad about what John Uba asked, because it means that people at least are interested
in their eye.
Yes, so please, by all means, go to a general hospital for your checkup. Hello, good morning.
Yeah, good morning.
Good morning. What's your name and location? All right.
Yeah, is there any you can teaching that can at least help your aging process with your eye? Maybe like people say alligator pepper, all those things, just natural remedy. The doctor can help us.
I think you already mentioned it, but I guess they want you to say it again and maybe dispel some myths about it.
Okay. There's some dietary advice that we can give to try to maintain our eye health. And as we grow older, we should actually eat foods that are like fish, oils, foods that are rich in omega-3. We can have carrots, are good for the eye, dark green leafy vegetables like spinach, which is all over the place here. We should take care of our health, really, because almost everything that happens inside our body is reflected in an eye condition. In this talk, we have not mentioned glaucoma at all. And in this environment, it is important because glaucoma is another cause of painless gradual loss of vision. Unfortunately, it is irreversible. The damage that glaucoma causes to the eye is irreversible. It's not like cataract where you can have a surgery and begin to see the next 2 days. unfortunately, and then people should watch out for it. One of the things that you do look out for when you come for a comprehensive eye check is that glaucoma. We don't even know what causes it. So it's not a matter of what did I eat or what didn't I eat. Sometimes it's in the genes. And what you can do when you can't attack the genes is to maintain what you have. So an eye check, you can also, if you're diabetic or hypertensive, it's always nice to see your eye doctor more frequently because these conditions affect your vision. And the medication for hypertension is not the same that would maintain your eye. So there's so many things so many reasons to see your eye doctor, really.
Wilson on WhatsApp is asking if potatoes are good for the eyes.
Potatoes are not bad for the eyes. If you say potatoes are good for the eye, you give the impression that as long as you are eating potatoes,
you're fine.
Then you're fine. No,
Exactly.
they're not restricted for the eye unless you have another dietary condition like diabetes that restricts stuff like that. And like I said, diabetes affects the eye. So in a diabetic person, everything in moderation, follow the dietary instructions, and you see that your eyes maintain their vision as well.
Thank you very much. So there is something that you said that took my mind to something that I wanted to ask. And you said when you're in your 60s and, and you're living up to the 90s, you start to have issues in your 60s and you're living up to 90s. So you can imagine how it will go down. So what is the fate of people who are already in their 10s, their 20s, their 30s, and already have eye issues? What's their fate?
Okay, some in their 10s or earlier, they may have been born with it, like congenital. For the younger generation, we advise an eye checkup every 2 years. But do you know that by the time a child is 6 years old, he or she should have seen an eye specialist at least once in that lifetime? By the age of 6, whether there's a complaint or not, this is for an eye assessment. So it's not all gloom and doom for some conditions in the young people. But all we're saying, the message here is take care of your eyes in the future by modifying your lifestyle, by making good sense of your lifestyle even when you're young, so that at the end of the day, it won't be like, oh, we can't help you because we can't reverse the years. That's it.
Thank you. Hello.
Hello?
Hello. Please turn down the volume of your radio.
Yes, I've done that now.
Great. What's your name?
Good morning.
Are you there? What's your name and location?
Me? Oh.
Can you hear me?
Yeah, I can hear you now. Good morning.
Good morning. Your name?
Yes, my name is Ugo.
All right, go ahead.
Please, I want to ask. Most times I wake up in the morning and my right eye is so blurry. It's like I barely see anything. That can happen once in a while. And I'll start feeling some sort of pain. But if I could sleep and, towards the evening, it will clear off, 2020, I was badly beaten by some policemen. A policeman and 2 soldiers at Tinkan. So it now affected one of my eyes. It developed a cataract. So I had to do a surgery. I was 30 as a then. So I am asking, what is the cost of that thing? And I noticed that one of my right eye, I see fire with the right eye, and I see closer with the left eye. Yeah, so that's what I was saying.
All right, thank you for your question.
Yeah.
Thank you. Are you seeing an eye specialist? Because there's 1 to 100 things that could be going on. And I don't know the type of eye surgery you had following that trauma. I don't know how far you can see. But the truth of the matter is, whatever is happening to one eye, if we don't want it to happen to the other eye that is seeing better, I think you should be seeing an eye specialist, and I would advise and counsel for that. Please do. Please do, because you already have a compromise to one eye. And we want to take care of the other eye as far as possible into your life.
Okay, I'll take this final call, even though we are out of time. Hello, good morning. What's your name, please?
Michael from
Festac?
Yeah.
We will send you an invoice for the number of times you have called today. Please go ahead.
We take bike a lot this part of the home. Can the doctor advise us on that? Concerning our eyes. Thank you very much.
What did he say? I didn't hear that.
He mentioned taking bike a lot. So what you
Bike.
probably can, what you can do to protect your eyes?
One of the things that is so common is just to wear sunglasses. Just like the simple move of wearing sunglasses will protect your eye from flying objects while you are going in the windy ride of the bike. So foreign body will not, dust and all of those things will not enter your eye. And then wearing sunglasses will also protect you from the sun rays. So the simplest thing you can do is actually to wear sunglasses when you're, and a helmet when you're on the bike.
Thank you. So it's not just for fashion, it's for your health too.
Yes, it is.
We are done for today. Is there any final word you would like to chip in before we wrap it up?
Well, I just want to put it out there from your youth, eat for your eyes. Eat to keep your eyes healthy. Have your regular eye checkups, irrespective of whether you are waiting too long in the hospital or not. Invest in the future eyesight by doing the right things and seeing the right people. Glasses, the wearing of glasses is not a disease. We all want to grow as old as we possibly can. And our eyes are meant to serve us for the duration of our lives. So let's take care of our eyes.
Thank you for your time and thank you for everything you shared with us. I'm not sure
Thank
you're
you.
active on social media, are you?
I don't know, not particularly.
Yeah, so I was going to ask you to drop your social media handles, but you're not that active. So we'll take what we can get. And of course, recommend anyone to go back to this link on YouTube. That is youtube.com/smooth921FM Lagos.
Thank you for having me.
It's absolutely my pleasure. Thank you, Lagos. Thank you, Nigeria. Thank you, world. Thank you for being a part of this show. Like I mentioned, it will still be safe for you on YouTube. And if you're part of the WhatsApp family, we will put the link on our WhatsApp status so that you can just directly go there and click on the link and watch. Please take care of your eyes. They are the windows to your soul and also the lights to your body. You want to do that. So take care of yourself. On the other side, I'll be joined with the children, and that will be Curious Minds for children between 6 to 15 years of age. Come around, children. Let's learn, let's spell, and of course, learn how to speak your mother tongue as well before you call me, because that's how you are greeting me. Learn that language. You have no option. As long as Auntie Sheon is on the show, you don't have an option. You must learn your mother tongue. See you on the other side. Mind and rest. Thank you, ma'am.
Thank you. Okay, then.
A lovely.
The social media handle I have is not personal. It will be like advertising my clinic if I said it. That's it. So I don't know, this restriction is there. Thank you for having me. Have a nice weekend.